Now, abdominal fat we call toxic fat. Toxic because, as I alluded to briefly, it produces bad chemicals that are getting in the way of normal functions. And the most important of those bad chemicals are those that are selective antagonists to the blood sugar lowering effect of insulin. So when that happens, when you have an initial burst of antagonistic chemicals that keep the blood sugar from being normal, because that's the most important function of insulin, blood sugar rises. And then what happens is that you get a reflex secretion of extra insulin. You don't have to think about it, it happens automatically. And therefore, your initial blood sugar is normalized. However, that's not the end of the story, because insulin has other actions that are not antagonized by the insulin resistance factors that I've mentioned. And the most important of those actions is that insulin is the fat-building hormone of the body. So what goes on here is that you've locked yourself into something that I call the metabolic trap. That is, because you've made more insulin in response to the threat to your blood sugar, now you have more fat, which in turn gives you more of the antagonists. So these people are on their way to diabetes. They're going up and up and up and up. So when they have reached sufficient obesity and they're old enough, they will outrun their capacity to make enough insulin, even though they're making a lot more than the average person, and they will become a diabetic. Now, interestingly enough, we can, and we've done it time and again, we can reverse diabetes when people come to us as established diabetics, simply by the program that we've talked about. But most people who come to us are not yet diabetic. However, they have a family history and so on, and we're aware that we have to help them prevent diabetes. And we do this by the same program. That is, it's a low carbohydrate program with the improvement in their sleep, serotonin, and then they can be kept from becoming diabetic. So I think that the insulin story is very interesting, and it ties in with this. This is not simply a matter of good sleep will do everything, although it'll do a lot. I think you have to have the lowering of the insulin through carbohydrate restraint. That explains why we feature both the low carbohydrate diet and trazodone. Is that okay?
Yes, but one more question, very quick one. Let's say in a person who has elevated level of triglycerides, fat which derived from carbohydrates, is it okay to prescribe medications like Lopid or Tricor to bring triglyceride down? Will it help his diet?
It'll help ultimately if you need it, but my point is that we give them a chance at weight loss using insulin reduction and so on. And it's so sensitive to insulin reduction because it's driven by insulin. Triglycerides are under the influence of insulin mainly, that you don't need the other medications. I agree that there are some patients who don't so respond and they require medication, but most of them do not. Yes?
Is there a correlation between sleep, good or bad, with high or low blood sugar readings in the morning?
Well, that's a very interesting question, and I think that I'm going to call it the DAWN phenomenon, D-A-W-N. People who measure their blood sugar at night, and it's reasonable, and they have eaten nothing during the night, they wake up with it 30 or 40 points higher or more. So why is this? Well, there are 4 stress hormones, as we call them. And these hormones, which I won't name, have the power to generate sugar or glucose from non-sugar sources. And they do so mainly at night. That is, I call it the dawn phenomenon because it starts about 4 in the morning and it lasts about 5 or 6 hours. Now, first of all, being made aware of this is important, but I think that when you have this phenomenon going on, it's an indirect measurement of the amount of stress that your body is experiencing. You may not feel any external manifestations of that stress, but this is what's doing it. So when I have people who are manifesting the dawn phenomenon, if they're not on enough trazodone, I raise them, because this is the way in which it's indicated. Is that clear? Okay, yes?
What's your experience with post-Roux-en-Y patients who are currently and have been on trazodone for a very long time?
Well, I think that this is a mixed bag. I think that the intestinal bypass surgery is done in patients who were incapable of losing weight. But let me say that they didn't see us, so that we have had people who were hurried along towards surgery and who managed to find us first, and they don't need it, they lose enough weight. But the fact is that trazodone may not be in sufficient amount for those people. I mean, it isn't that it isn't working, it's that there is a balance between the loss of serotonin by stress, and that can be considerable, and the replenishment of it by an appropriate amount of
Is there a
trazodone.
maximum of trazodone that's recommended? Because
Well, I'll tell you that with my extensive experience, I probably prescribe more trazodone than any other doctor in the world. I would say that because it's something that I have a lot of confidence in, and I also am comfortable with it. But the normal upper limit is 600 milligrams. Now that sounds terrible, but it's actually what was given to the depressed patients early on when it was first used, and there was nothing else. There was no Prozac. But there are people who need more than that. And if they understand that going up to 650 or 700 is something that's off-label, definitely, but that we'll watch them. And if they get better on it, as some of them do, then I don't see any reason why we should deny them the help because of some arbitrary boundary, okay?
so do you work with the insurance companies to get that approved?
I do, yeah.
It's just the telephone. Yes, right there, doctor. Yes, you.
What is the, what are some complications, medical indications that are negatives about taking trazodone, and what medications that somebody might be taking that don't permit you to use trazodone?
Well, as far as complications are concerned, if you know how to do it, there are relatively few. I think that this is an enormous challenge for patient and doctor because the dose of this medicine is not the same in everyone. One size does not fit all. But the dose that is given is the dose that works. So we have to start low. There are people who are exquisitely sensitive to trazodone who need only a quarter of the smallest tablet. This is not common, but the way in which we start people is we start low and we gradually progress upward so we don't miss the sensitive people and overdo it.
Dr. Ezrin, I have a quick comment.
Yes, okay.
Trazodone serves ultimately as an appetite suppressant because we're upping your serotonin stores, which is when you're deficient in serotonin, you will be craving carbohydrates. So trazodone is very important in order to help you actually stick with our low carbohydrate program as to prevent the cravings for carbohydrates. And so really both are important. If you just take trazodone but don't do the low carbohydrate, specifically this nutritional program, that magically will not just take off your weight. You will probably crave less carbohydrates as to maintain your current weight, I would say.
Who's next?
Does trazodone contain serotonin, or does it?
That's a very good question. I think of all the sleeping pills out there, only trazodone has a small serotonin effect. That is, its major metabolite, that is what the body deals with it. It changes it into something that's one alteration less. And that acts as serotonin because it connects with in the brain what we call, it's a serotonin receptor agonist. So you get the effect of serotonin, you can't get it with anything else.
Does it causes your body to produce it, or it actually?
Well, it causes your body to produce it in the sense that once you get a good sleep going, in the first night that you're sleeping well and you're going down 3 or 4 times to that deep level of restorative sleep, then you're going to be multiplying the serotonin right off. So it gives a jump start of sleep, a jump start literally of serotonin equivalent, and then the body takes over from there.
I see many more questions. Yes?
Could you please define carbohydrate craving?
Carbohydrate craving?
Yeah, what do you mean by that?
Well, carbohydrate is everything. Well, food is divided into carbohydrates, protein, and fat. And so carbohydrates are starches and fruit and milk and juice. And there's refined carbohydrates and complex carbohydrates. And if your meals are based on carbohydrates,